This is Andrew Hadeed, one of the orthopedic surgery residents at Samaritan, presenting COVID quarantine and school closures impact on pediatric orthopedic fracture care. March 13, 2020 marked the closure of schools and sports for the entire state of Oregon. Until June, school was carried online and kids were quarantined at home. The purpose of this study was to determine how sports and school closures change the epidemiology, demographics, and treatment of pediatric fractures. A retrospective review was performed of patients 0 to 17 who presented to a single level 2 trauma center with a pediatric fracture. The time period of March 13 to June 13, 2020 was compared to similar time periods in 2019, 2018, and 2017. We can see in Figure 1 that there's overall a downward trend in the number of pediatric fractures presenting to this hospital, and there was an average of 73 fractures from 2017 to 2019, with only 45 in total presenting in 2020. In Figure 2, we can see that demographics really hasn't changed in terms of the morphology of fractures and the location. In Figure 3, we can see that there's an increased number of fractures sustained playing at home or at a playground, either on a bike, skateboard, or trampoline, and also a higher incidence of patients in the other column, which would be at home by themselves, and the parents are not sure what they were doing. There's a lower incidence of sports and school injuries as expected.